class. This is part 3 of the basic care and comfort. It's a practice question. We're going to practice some few questions, but these are high yield facts that you need to know. This topic is difficult, it's broad, it's all common sense, and what you expect to be done for you if you're a patient. I think that's the key questions. So this is the first question. Sorry, guys. How should the nurse assess the patient pain? I'm going to highlight keywords, and that's all you need to focus on. How should the nurse assess the patient pain? 55-year-old male client is now post-op left thoracotomy. The client rate his pain 7 out of 10. How should the nurse assess? This question is asking you specific question. You have to break it down. Ask the patient again about their pain, facial grimace, document whatever you think they told you, and check the signs of respiratory distress. What exactly is the question asking you? Patient had big surgery, and you rate the pain 7 out of 10. The nurse, how she should assess the patient pain? The key in answering question for this one is, what is the definition of pain? Do you check and ask them again if they have 7 out of 10 pain? Or you check their face and see if they have grimace to tell you they are in pain? Or you check and just document whatever they told you is what it is. Or you wait until they are in respiratory distress. Expect them to try to ask you this kind of question. It's a concept. What is pain? Every time they ask you pain question, it's the same concept. They're not going to change it. What is pain? It's what the patient told you it is. It's not because you're going to ask them again. You don't believe them. If he said 100/10, you got to believe them. You don't wait until they show in their face. Some people will smile when they're in pain. That's the way they deal with it. You document what they told you. It says 7 out of 10. Take it what it is. Why? Pain is subjective. It's not objective. Subjective. That's the key buzzword. It's a subjective. So take whatever they told you and move on. You waiting until they have respiratory distress? No. That's bad. Document whatever they told you is the problem. Okay. Number 2, like I told you, concepts. Which of the following statements from the client indicate correct understanding? 35-year-old client with what? Leg edema after prolonged standing. I just received teaching on the use of stockings. I've underlined keywords. Correct understanding, use of stockings for edema. What is the buzzwords? Use of stockings, correct. What content do you need? If you have stockings, please leave it alone. No manipulation at all. You see the content I'm doing too? This is all I need. Anything I do to the stockings is a problem. Never touch the stocking. Leave it the way it is. Fold the top of the stocking above the knee. No. Keep it straight the way it's supposed to. Cut it. No. Don't manipulate it. Ensure that there's a small holes in it. No. Don't touch it. Just wear the stockings before you get out of bed so that you don't develop edema. You're supposed to put it on before you get out so that you can prevent the edema. Buzzwords, never manipulate it. So every answer choice, never manipulate. And if you use that, you have to choose number 3. So this is your answer. Test-taking strategy. It's no magic. It's just like trying to use a knowledge base, eliminate the answers, break the question down. This is the same thing. Which of the following prescription the nurse should recommend? A 35-year-old who is post-expiratory laparotomy, don't worry, surgery. Patient is requiring pain medication, what? Every hour. I have a patient every hour is requiring pain medication. What do you think you should do? You give them IV acetaminophen, you give them Valium to depress their respiratory system, or you give them patient control anesthesia that they can manage it on their own. Or you provide fentanyl patch that is used for what? Chronic problem. This patient has an acute problem, a cancer, a chronic problem. These 6, the nurse, the patient is requiring every hour. This is not going to provide that pain. Valium is going to affect their respiration. Patient control, yes, this is telling you need to give them something better that they can control the pain themselves and you don't have to worry about it. PCA, your answer. And I'm going to build on it. This is the building up. Which of the following describe the prescription? 35-year-old, had surgery, PCA was ordered, 0.2 demand dose in 1.2 every hour, and a lockout for this. You should be able to interpret this. When I give you 0.2 demand, that means every time you push, you're supposed to get 0.2. If it's within the 10 minutes, that means in 10 minutes, you can get only 0.2. If you push 50 times, you only get 0.2 in 10 minutes because there is a lock time. In an hour, you can get 1.2. That means in an hour, you can push it 6 times and get something. Out of the 6, if you push it 20 in an hour, only 6 times you're going to get medication. And every time you push within that 10 minutes that you due for, you get 0.2. You never get anything more than 0.2 in 10 minutes. Therefore, client will receive a total of 2.2. No, 1.2. Client will receive 0.2 in 10 minutes. Excellent. Client will have to wait every hour. No, wait 10 minutes. That's the lockout. Client will receive 0.2 on demand anytime. No, you get 0.2 in 10 minutes, but you can push it 500 times in 10 minutes. You're only going to get 0.2. You should be able to interpret PCA. This is what you do when you go to the floor. How to read a PCA order: demand, hour, and lock time. Therefore, this is your right answer. Number 5. Which of the following practice using crutches need immediate evaluation? We got to intervene. 40-year-old sustained left tib fracture. X-fix was placed and client was placed on non-weight bearing on the left. Break it down. Left leg is bad, and I have right leg as good. So what is the patient doing that you need to intervene? You have to know this. I mean, there's nothing I can explain it to you about this, that you have to know it code. Assisted device, when they use it, when they're going up and downstairs, when you're walking straight and then sitting down, you have to know it. When you're going up, you go up with the good leg. So client lead means first with the what? Right leg. Right leg is the good leg. Therefore, this is good. Client lead with crutches when walking straight. Yeah. When walking straight, crutches and affected leg. So this is good. Client move the crutches to the hand of the unaffected side, which is the right side, when sitting down and standing. This is bad. When you're sitting down and you're holding a crutches, you have crutches, you put both crutches to the side that is affected so that you can use your hand that is not affected as to bear weight and lift yourself up. So if you have 2 crutches and your left leg is broken, when you're about to sit down, the crutches on the right side, give it to the left and the left hand is going to hold those two crutches. And you use your right hand and you put it on the resting chair and use it to lift yourself and put yourself down. He's using his good hand to hold the crutches. Bad. So this patient is bad. Hold the arm rest with the hand of the unaffected. Yes, to give yourself support. So 3 is bad. This question, I said it hard. You have to know all these types: walking, going up the stairs, sitting down. That's the way I did it so that you can think fast. Okay, so that's that one. If this is your first time watching Adapt NCLEX, subscribe. You get more content like that. You can leave some comments if you like it, and then you can click likes too. This is also a content. Short 10 questions will be done. Which of these orders below the nurse should acknowledge? That means take it. A nurse is caring for a client who had anti-embolic stocking placed as ordered by the physician. Which of these orders below the nurse should acknowledge? All I'm saying is, if you have anti-embolic stocking, you don't leave the patient alone and keep the stocking on 24/7. There's a principle. Do you do assessment every 4 hours, every 6 hours, 8 hours, 12 hours? You have to check under the stocking. It's compression. You can compress them. You got to check the skin, vascular exams, everything. General knowledge every 4 hours. 4 hours is too slow. 6 hours in the middle. 8 hours is the best. 12 hours is too far. So you check it. So you end up doing it at least 3 times. 3 times a day, basically, throughout the day. So every 8 hours, you got to check it, put it back on, and make sure they're doing okay. This is another question that you should know. If you don't know the difference between clear liquid, full liquid, you should Google it and you get a bunch of lists. The key is which of these orders below the nurse should acknowledge. A nurse is caring for a client who has a clear liquid diet order. All this means is I can see through. There's no pop if there is a fruit juice. And there's no what? There's one more. There's no milk. There's ice cream, milk there. I can see through. There's milk. You see what I did? You got to pick this. Number 4 is popsicle. You can have tea, no milk. You can have coffee, no milk. You can have fruit juice, but you got to see through, or no pop. So that's that one. And this is caring for a client with new diagnosis of diabetes. During discharge teaching, the client said, well, this is the end. I will never be able to drink my milkshakes anymore. What is the best response by the nurse? You have to be therapeutic, straightforward, therapeutic. It will help with your diabetes. No way. That is the point of the teaching, being sarcastic. Why do you say that? No why question. Always tell me more. Always tell me more, tell me more. Open-ended question. And the patient is going to be happy. It's therapeutic communication. Number 9. Which of the following the nurse should include in the plan of care to alleviate what? Client concern. This is a long sentence, but there's only one word that is important. A nurse receives a report on a client who does not like being in the hospital, does not want to be in the hospital due to what? Prior safety issue he encountered in the last admission. He saw safety. He wants to be safe. That's why he doesn't like to be in the hospital. So what would you do to make him safe? Keep the door open at all time. You need privacy. Keep all 4 rails up. Think about it. This is you restraining him. Keep the light on at all time. You can sleep. Sleep hygiene. You see what I've done? Eliminate this, and that. All based on safety and not a good problem. So this is all wrong. If you provide a clutter-free environment, it's not going to trip, it's not going to have any problem, and it will be happy. Number 4 is your hands. And the last question is a calculation question, just to show you people always have problem with this. They say strategy. First thing, there's a different kind of caps. But when they give you one cap, if most of what they will give you in your question will be 1 cap, 8-ounce cap. And this is always equal to 240 ml. Then you do the calculation. 1 cup of ice is the first one. Ice chips is going to melt. When it melts, you get only half of it. So 1 cup is 240. When you put it in your mouth, it will melt. So you have 120. Half a cup of ice cream. 1 cup of ice cream is 240. The ice cream is already melted, so you don't need to divide it. But I give you half a cup. So half a cup divided by 2 is also 120. 1 cup of rice and beans. You take away solid out, 0. Pureed. Also, you take it out. You never had a pureed. So the only thing you're going to have is 1 cup of ice chips and that one. Okay, so this is what? 240. Right? And now there's what? 30 ml every hour, normal saline in 6 hours. That means you receive some IV fluid. Every hour, you get what? 30 ml. So times 6, right? It's going to get times 6, which is 180. So that plus that will be, this is what? This plus this plus these 2, this is what? 420. Okay, so that is the total intake. What is the output? Urine, 30 ml every hour for 8 hours. So output, 30 times 8. That's what? It's 240. Then he has loose stool. Loose stool can be considered liquid. So okay, if they say loose, and you can quantify 2 cups, so 2 times what? 240. That means what? 480. This is 0 to 7. Large bowel movement. Bowel movement is solid, so you take that one out. You can't count it. It's not a liquid. So to calculate for the net, you have to, so in is 420 out. So this is negative 300. That means the patient is dry, is dehydrated, they need more fluid. That's how you can do those calculations. Straightforward. They will confuse you. They will confuse you with caps. Don't worry about it. Most of the time, it's regular 8-ounce cap. And this is the way you do it. Adapt NCLEX. If you've never seen this before, subscribe down, check Adapt NCLEX, like the video, and you'll see more of this. You enjoy yourself. And if you need anything, just email me. But take care of yourself. Have a good night. Keep charging as always. Take care of yourself. All the best of luck. Bye-bye.